The Cardiac Services Program at St. Boniface Hospital is renowned for its low mortality rates, patient satisfaction, and clinical research. And what took place 55 years ago likely laid the groundwork for its success. In 1959, a Winnipeg doctor led the first open heart surgery in Manitoba. His patient, a 5-year-old boy. In this month's Modern Medicine, we introduce you to that boy, who's all grown up now, and we show you how things have changed since his trip to the OR.
Looking back, you're Chanel #1. There you go. That's what I told him.
It's true. Eugene Chanel is the first of his kind. 55 years ago, at just 5 years old and 27 pounds, Chanel was the first patient ever to undergo heart surgery in Manitoba. He was born with a congenital malformation.
It was a hole in between the walls of the heart.
These are pictures of the actual surgery in 1959 at St. Boniface Hospital. It took 4.5 hours, and Chanel only had a 50% chance of survival.
The equipment in those days, the drugs in those days, the sutures, the needles, the ability to diagnose, that was one of the biggest problems why, but prior to Eugene's case, that many of the children died because the diagnosis was not correct, because we didn't have the echo machines and the CT scans and all that kind of stuff that we use right now to diagnose things accurately. So when you went to surgery, you know exactly what you needed to do. It was guesswork back then.
The man making those guesses back then was Dr. Morley Cohen. The Winnipeg-born doctor put Manitoba on the map. He was the first director of the cardiac surgery unit at St. B and helped develop the artificial lung.
Morley really was at the leading edge of the development of heart surgery.
Today, Dr. Menkes is in charge, and a lot has changed. Patients with Chanel's condition now only have a 1% risk of death. The procedure takes half the amount of time, and little guesswork is involved. While it was a riskier road for Chanel, his trip to the operating room was the first and last for him. His heart has worked perfect ever since.
Heart's all good. I don't see any particular doctors for any specifically with that. So.